Good morning, Don Elwell here with the Medical Hour. And of course, there's always a special guest. And with this particular guest, you never know which guest you're going to get, because over at Lakeside Dental Arts, they've got like all these different doctors. Sometimes I get Dr. Willie, sometimes I get Dr. Musa, sometimes I get Willie, Musa, Helvey, Dr. Helvey by himself. You never know. Sometimes I just get like the receptionist all come in. I'm just kidding about that last part. But anyway, it's always one doctor or another, and today it is indeed Dr. Dalton Helvey. How are you, sir?
I'm doing well. How are you?
Good. How's everything going?
It's going really good.
You got to be getting a little bit of a slowdown maybe because of the season kind of ending, or is it not slowed down yet?
You would think it would get slow, but we're still waiting for that, for a little breath of fresh air. But
no slowdown just yet. Okay.
Not quite. Not quite.
All right. Well, that's
good though.
I was gonna say that's a nice problem to have, especially when you have three doctors. I mean, a year ago you only had the two because you hadn't arrived yet. When did you arrive?
July 1st was my first day.
Okay, so you're almost on the 1 year anniversary there.
Absolutely.
Any special thing that happens at 1 year? Is there any massive celebration or anything?
Do another filling and treat another patient.
Wow, sounds special.
I mean, I'm sure I'll have a short little moment to myself. Oh, cool! It's been 1 year.
Yeah, they'll probably do something. You might get like a cake or cupcakes or something. You never know. Exactly. So that'll be good. But anyway, I'm coming up with the 1 year mark course, Lakeside Dental Arts. For those of you that don't know, by the way, and if there's a few of you that probably don't, it is at I think it's 2660 US Highway 27 South. Just on the shores of Lake Jackson, kind of across the street from the brand new Culver's down there at the south end of town, and near the public shopping center there. One of the things that we always kind of talk about, we always touch on it, because I just continue to be amazed at it, and that is, of course, the reputation and the online reputation. If you're looking for good dental care, if you're looking for just a place that just kind of definitely exceeds expectations, if you've got a kind of a preconceived notion of how dentistry is, this place is different. And this place, like I said, they wow everybody. They have 932 as of right now reviews, or Google reviews online, and their average score is indeed a 5.0, and we're just talking straight up 5.0, and it's not. With 932, that's a lot. That's just a ton. They have 7 reviews just in the last 2 days. Mm-hmm. I mean, and everybody's a 5. I was just looking at that says like, the atmosphere is like being at a spa instead of the dentist. Get like that. I mean, and then one gentleman obviously is a repeat customer and said all perfect as usual. I had my first visit today and it was an incredible experience. Dr. Musa and Julie were professional yet compassionate, kind and caring. They explained my tooth problem after carefully and thoroughly examining everything. I just, thank you, Dr. Willie. I see your name getting broken onto here a few times. Always a good thing as well. So I mean, you guys just really doing everything right.
Yeah, absolutely. That's what we really work our hardest at, is just that experience, for it to be different. With our motto, experience the difference in dental care, we really try to be different, and it shows through those reviews.
Yeah.
We're with the private practice that we have, and the ability just to really take our time with each patient. We're not rushed. We don't overbook ourselves. That if a patient has questions, we're going to sit there with them and answer them, and make sure they're comfortable with the treatment they're going to receive. And,
sure.
And then, like you said, a lot of people feel like they're at the spa. I mean, it helps having massaging chairs and all these other things in the view.
At some particular point, somebody just was like, you know what, let's try this.
Yeah, right.
It worked.
What else can we do?
Yeah, I mean, well, and like you said, you've got I think there's like 2 TVs in the room.
Yeah. So there's it's so funny because every time someone's never been in our office their first time there, and they usually see the TV in front of them, and there's usually a show on or something while they're waiting, and
right.
As soon as we lean them back to get started, there's one above them on the roof, and they're like, I didn't even realize that was there. It has the ability to play movies, Netflix, YouTube TV, all those things. So it's just nice, especially in some of these longer procedures where rather than their wandering eyes just watching what we're doing, and that just increases their stress and anxiety, they can just totally tune out what we're doing and pay attention to
turn on Netflix. So, have you seen the Matrix movies? Whatever it is. Yeah, it's just
it always seems we have cooking shows on at like right before lunch, and we're like, let's change this one to something else.
Yeah, exactly.
We're all hungry too.
No doubt whatsoever. And then of course, like you said, you got the massaging chairs. I mean, every one of the studios, I guess, or the rooms, if you will, they all face Lake Jackson. I mean, so there's just and huge panoramic views, and they're big old plate glass windows that just show Lake Jackson. So I mean, you can't get a whole lot more relaxing than that. had you turned the building around, you'd all be looking at US 27, which is a lot more stressful.
That merge from Lakeview on the 27 is what they would be watching.
Yeah, entertaining, but probably a little more anxiety-inducing for sure. Yeah, so I think it was a good idea. Whoever decided to put the windows on that side, I think that's brilliant idea there. So, of course, talking with Dr. Dalton Helvey. By the way, LakesideDentalArts.com is that website. If you want to go there, you can certainly just go straight to it. You can also just Google them, and you can see all those reviews that I mentioned to you. Their phone number, if you want to give them a call, kind of old school. They're open now, right? You guys open at 8?
We are, yes, sir.
It's 863-658-4272 is the phone number. Again, it's 658-4272. We got tons of stuff to talk about. I'm going to put you on the spot in a little bit, but I want to. We talked a little bit about the whole experience, the difference in dental care. But I want to put you on the spot, and I'm going to give you about 2 minutes to prepare for this. And that is, I want you to tell me when we come back your top 3 things that kind of differentiate you guys from every other dentist that is in Highlands County, if you will. The top 3. And we'll go in reverse order, too. We'll make it kind of exciting.
Oh, okay.
All right, very good.
Make me think already this morning.
Exactly. Dr. Dalton Helvey, Lakeside Dental Arts, and the Medical Hour will continue in just a minute. Don Elwell with the Medical Hour, talking with Dr. Dalton Helvey of Lakeside Dental Arts. They, of course, are at LakesideDentalArts.com. Can't miss that website. And having a good time as usual here with Dr. Helvey, because there's just so much to talk about. You were actually just before we went on the break, we talked about the fact that what is that? There's a slogan that you mentioned that Dr. Willie tells you about that kind of defines a little bit of that whole culture. And what was that slogan again?
Yeah, so he has a motto of work 4 days in your practice and the 5th day on your practice. So a lot of people, when I tell them I work 4 days a week, they're like, oh, that must be nice. But I mean, we're so busy those 4 days. Yeah. On that 5th day, we spend learning, honing our skills, and other things we want to learn about. Especially Dr. Moose and I, earlier in our careers, there's a lot of things we still want to continue to learn. Or if we have a big case we want to work on, we take those models and we can sit down and analyze them when we don't have other patients calling our names that we have to go treat. So it's really nice. It's a good, healthy balance, but it also gives us the time to really fine tune things,
sharpen the skills.
Yeah, and provide the excellence that we provide rather than just quality over quantity there. So,
sure.
Yeah.
But for those 4 days, I mean, those aren't short days.
Yeah.
Those are long days. And they're hard ones, right?
I get home and I'm like, wait, what time is it? What happened today? We don't. Sometimes I don't know which direction is up by the end of Thursday, by the end of today. But it's been a great week. So far I'm good. I've been able to go to the gym for a few days. I think that helps clear my head too. Sometimes.
Sure.
Like, all right.
Well, yeah, you gotta have that.
Get some blood flow.
Something to kind of break up the monotony a little bit.
Right.
Yeah,
Absolutely.
Absolutely. All right. So, we've heard the slogan, experience the difference in dental care. So I'm gonna put you on the spot a little bit. Mm-hmm. Top 3 things that differentiate Lakeside Dental Arts. Why is Lakeside Dental Arts as good as they are? Why, again, a flawless, perfect 5.0 with almost 1,000 reviews. It'd be kind of a big deal. When you get number 1,000, you should probably do something for them.
Yeah, we'll probably celebrate that.
You're getting close to that one. Yeah, 932 is where they're at right now. So if 70 friends are listening right now, you can make it.
There you go.
So let's do this in reverse order here, kind of like a Family Feud kind of thing. All right, so tell me what number 3 is on the most important things that differentiate you.
Yeah, number 3, I would say, is just our emergency availability. We obviously talk about it here a lot, but it's a big deal because you hear all the time people come in and they say, oh, I called 4 or 5 other offices and they couldn't get me in for 3 weeks, 4 weeks. And I mean, these are people in pain. And could you imagine living with some severe pain for 3 more weeks? And,
I mean, when you have a dental emergency, it's
an emergency.
Exactly, it's an emergency. There's always pain. It's not like something. The light turned on the dashboard. I'll take it in. When I get a chance to.
Yeah, and I think it's our responsibility as dentists, because one of the most improper uses of the emergency department is for dental emergencies.
Sure.
At least our hospital here doesn't have a dentist on staff, and a lot of them, when they do, they're not going to call a dentist in the middle of the night just because you have some tooth pain. They're going to give you an injection, get you nice and numb, and maybe give you an antibiotic and tell you to go see a dentist. So
right.
The fact that we really, every day we have emergency spots, all 3 of us, Dr. Willie, Dr. Moose, and myself, we sit down and say, okay, where do you want your emergencies today? And so we plan on having call-ins, and we have those spots filled every day, which is nice.
Yeah, so all right, so you literally have spots available every day for those people that invariably you're going to get a call or two because somebody chipped a tooth on this or whatever, something fell out, right? Or whatever. So that's awesome. So, and I know that when I scheduled my first appointment with the ologist a few months ago, it was one of those things where they like, yeah, we can get you in tomorrow.
Yeah.
And so, I mean, it wasn't an emergency. It was just really just a new patient, if you will. But so many times, especially during the season, and even right now, we're kind of in that not quite full summer mode yet, unless you look at the temperatures.
Yeah.
Where it can take 2 weeks, 3 weeks, 4 weeks or so to see an actual professional. So the fact that you all have to book out that time is great.
Yeah, absolutely. And it just goes to show with how well trained and in tune our staff is, really, because they're the ones that, when they're efficient, it allows us to be more efficient, and allows us to be able to see a patient the same day when we don't know what their medical history is, what their needs are, what the scenario is. We don't have any type of record on them until they walk in. And so they're able to get all that information, put it together, and come to us, show us, hey, this is what the patient needs. We go in, we meet them, and we come up with a plan. And on those emergencies, we can't necessarily guarantee treatment, because it might be more extensive than we can do in a day. It might require some more planning, but I would say 9 times out of 10, we can at least offer some type of treatment that day. And if it's pain, we can usually get them out of pain that day.
Yeah, no, and it's like I said, that's absolutely huge. And you mentioned before the importance of the staff, and from my firsthand experience, the staff is amazing. Yeah. I mean, everybody from the receptionist to the hygienist, everybody across the board, really committed. And again, if you go to look at any of those reviews, almost every one of them mentions either staff or hygienist in them.
Yeah.
And so they do.
Yeah, everyone buys in. And I think that shows from the culture that Dr. Willie and Allison have cultivated over the years, that they're committed to the excellence just like we are. Like, we not only do we want to do the best fillings and crowns we can do, but they also want people to have the best experience they can have, because they know at the end of the day that's just what we're about. And then people get really excited actually to come to the dentist, or they look forward to coming back. And you hear it all the time. People have better relationships with their hygienists sometimes, because they see them for, some of our hygienists have been with Dr. Willie for many years.
Sure.
And so their patients have been with them for 15, 20 years. And or when hygienists leave practices or move different areas, a lot of patients will follow their hygienist. We have patients that come from Orlando just to get a cleaning, because they had their cleanings with Taryn for 10 years when they were in Sebring. And now they want to see Taryn for the long run, so they still come back an hour
Isn't that
away.
Crazy?
So yeah, it's awesome though.
But it's again, we keep talking about the differences. When was the last time, listeners out there, everybody in the radio land, if you will, when was the last time you were excited to go to the dentist? When was the last time you looked forward to going to the dentist? It's been a while. It's been a minute, and so that's kind of the norm, if you will, with Lakeside Dental Arts. And like you said, it's the relationships. It's the fact that, again, it's that spa-like experience when you walk in the door all the way until you leave. So they take care of it all the way throughout. If you have dental insurance, people have said before, they don't take insurance. Well, they do sort of, in that I think you pay for the procedure or the process or the cleaning or whatever it was up front, but they handle the filing of the insurance. And so give it a week, 10 days. I think mine was about 10 days.
Oh, good.
And you got the reimbursement check from the insurance company there. So it was great. I mean, so, other than that little bit of a 10-day thing, it's exactly the same as in every other place. It's actually much more. I think it's really efficient, because you're able, like I said, to get in right away, and so you get that you don't have to wait for like prior authorization, all that fun stuff like that.
Yeah, and we still can do that. If we come up with a treatment plan and it's extensive, or someone needs treatment that they can't out of pocket up front, we can always still send that treatment to their insurance ahead of time and get a report of what the insurance is going to cover, so we know the patient's only responsible for the difference. They only have to pay the difference. So
perfect.
And they don't have to wait for it. It takes a little bit longer on that sense. Shout out to the insurance companies, but they at least, once, if it's not a pertinent need that they have to take care of right away, then we can wait some time and get that information back and do it when they're ready.
Very good. All right, so that was number 3. Number 3 was the emergency availability, which of course kind of expounded into some other stuff. So, all right, now we got to talk about what's on the big board. All right, there was only 3 answers. We did number 3. What's number 2 on the big board?
Number 2, I would definitely say the digital technology in total that we use in our office. So, there's very few offices in town even that have as much digital technology we have, and the ability to, the number one thing that we use so much every day is the ability to make same day crowns. And so a lot of people don't understand the significance in that. They think, oh, same day crowns.
Yeah.
Cool. What is that?
Yeah.
But if you've ever had a crown before, you know that previously you had a temporary crown.
Okay.
That was handmade, and it probably came off every time you try to eat anything more than two. And if it was in the front, God forbid you had a date or something important you had to be at, you know.
Right.
And so our technology allows us to skip that whole temporary phase. We don't have to take the big, large, goopy impressions that make you feel like the impression's running, getting an impression of your esophagus. So we do a scan, and then we make the crown right there in our office, and it's all in one visit. You don't have to come back. We don't have to rely on the lab to make something that may or may not fit, or may or may not be the right color. All that is cut out into one appointment, and saves significant amount of time for our patients, and then just cuts out a lot of the hassle around the idea of
in the past, it could take weeks. Basically.
Absolutely.
Okay,
yeah.
that would be normal for
that.
And
2 to 3 weeks.
So if somebody comes in now, and again, it's not necessarily their first visit, maybe they're an established patient, but they've already had a cleaning or something like that. But they come in and I got a pain here, doc. I can get this taken care of, and you say, well, you're gonna need a crown. From the time that they walk in to on a normal visit, I know everything kind of varies a little bit.
Right.
How long would it be then before they would actually walk out of there with a crown?
Yeah, we schedule our crowns. Anytime a crown is scheduled or someone walks in and ends up needing a crown, we tell them it's 2 to 2.5 hours usually.
That's it.
Yeah. So.
The length of one Netflix movie.
Right,
exactly. On the TV.
Exactly.
Yeah.
Sometimes you might not even get to finish the movie, but you can stay and finish it if you like.
If you want to. That's all right.
But yeah, and I always tell them it's a little bit longer of an appointment, but that's very, maybe 20 to 30 minutes of that is us actually working in your mouth. The rest of that time is us scanning and then designing the crown.
Right.
Us doctors sit down and we design the crown ourselves. We have a machine make it. It's fired in an oven, and then we let it cool down, of course. And we put it in.
We all appreciate that.
Yeah. So, so it's very impressive what we get to do there in a matter
That's amazing.
of a couple of hours.
Yeah, I mean, that's completely amazing that's able to be done in that little bit of time. And again, then that's not one of those ones that falls off. I mean, it's like you said, it's computerized, and I would imagine it's the variances are probably even so much better than they were before.
Yeah, much more accurate than a handmade crown ever could be, and which is impressive, because sometimes there are times where we put those crowns on with temporary cement, right?
Right.
If we're worried about maybe nerve damage because of deep decay or something, and we'll say, hey, we're going to put this on with a temporary cement just to see how the nerve responds. Come back in 2 weeks, we'll see where we need to go from there. When we go to take that permanent crown off that's placed with temporary cement, sometimes those things are hard to get off. So I always tell you, you're not going to have to worry about this thing coming off on its own, really. You just no candy apples, of course, but other than that, eat as normal.
Well, I don't know. Candy apples are pretty darn good.
They are. Not a good idea for temporary crowns. But yeah, it's very impressive, and people are always amazed at that. And it's cool. Some people are really more into the process and the technology, and depending on their backgrounds, and we've even walked them back to our lab to show them the machine, like, all right, look, this is your crown being made right now.
That's kind of cool.
In 5 minutes. So
how hot's that oven get?
About, I want to say about 1,500 degrees.
Holy cow!
It's hot. So,
exactly.
It cooks it for about 20 minutes, and it comes down, and that crown is just red hot. And
I would think
you could brand yourself with someone else's crown if you're not careful. So.
Sounds like a horrible idea, but okay.
We'd probably do it on the daily on accident. Is this thing, because it can still be 600 degrees and you don't know, it looks like a regular
it's not
crown.
red anymore.
You go and grab it, and then you know very quickly. You
don't have any crown gloves?
we have little tweezers that we put it on a little fan for it to cool, but we're very impatient. We're patient with our patients, but when we want a crown to cool down, we're like, all right, let's get this thing in the mouth.
Exactly.
You grab it a little too early, you don't have a fingerprint anymore.
I can understand that for sure. And now does that digital technology that you mentioned, obviously, that extends to crowns, it also extends to other stuff too.
Absolutely.
You guys are kind of cutting edge for so many different things.
Yeah, those machines we use to make crowns, we can do anything that used to require an impression, like making a night guard, or making whitening trays or anything.
Oh yeah.
We can use those machines. Dr. Musa's placing implants, so those machines help us with a 3D X-ray he takes. He places that implant digitally before he places it on the patient. for reasons of exact measure. So when he analyzes the bone and the most ideal place for that implant to go so the crown can look the best, he does it on a computer before he does it in a patient, and all that is done in that technology. And it just allows for a better outcome. Implant's going to last longer, and we're going to have a better aesthetic result because of it. So we're all using it. I use it for Sure Smile clear aligners, equivalent to what Invisalign is.
Right,
Nike
same
to Adidas. And so we use those scanners. We take those scans and we design the trays, and we do 3D printing of those trays to move the teeth and straighten and make a smile that people are more comfortable with. So it's all technology based now, which is impressive. Which is
great. I mean, like I said, because it greatly reduces or eliminates the need for like that second visit, to fix it or to adjust it or whatever, because it all gets it right kind of the first time.
Yeah.
So that's amazing. Right? So the digital technology, kind of state of the art, if you will, is certainly a big selling point. But I know you all are thinking, okay, what's number one? What is the number one thing that would differentiate Lakeside Dental Arts from everybody else, in addition to all the stuff that we've already been talking about? And we're going to touch on that in just a minute. We got to keep Dr. Helvey here for the full hour, so we can't just give it away. So we will deal with that in just a moment. Again, as the medical hour continues, stand by for number one. Anyway, Dr. Helvey, of course, Lakeside Dental Arts, 658-4272, by the way, is that phone number, 863-658-4272. They're located at 2660 US Highway 27 South, across the street from Culver's and VinFast All-Star Car Sales, just a little bit to the north of the Publix shopping center there on the shores of Lake Jackson. And a great location. And Dr. Helvey's been there for, going on about 11 months now, just almost. Getting real close.
Yeah, as a dentist, and it's been an exciting ride because Dr. Willie dates back to,
Be nice.
As far as my mentor.
Okay.
I don't want to count that far back.
I can see this getting ugly here.
As my mentor, he's mentored me since my years of high school. When I first thought about what I wanted to do for the rest of my life, it's like, okay, well, maybe dentistry. My mom's a dental assistant, and so she always talked about how much she loved her job and her patients. I always saw how happy she was, and she still working in the dental field. And so when it came time to what do I want to do? I don't know. I like working with people and start running through all these things. And I was like, maybe I want to be a dentist. And so someone referred me to go and introduce myself to Dr. Willie, and he just let me come and hang around his office and watch what he did and look over his shoulder and ask questions. And I would do that every summer during college when I was in undergrad years in Gainesville. I'd come home and spend time in his office during the summers when I was in classes, and it was great because I got to really learn the philosophy of his practice before I ever knew I would be practicing.
That'd be invaluable. Yeah,
absolutely.
Wow, that's a great topic. All right, we got to focus more on the mentorship in just a moment. Too. I want to kind of dive a little bit deeper into that and how that's kind of a pay it forward thing that we definitely want to talk about for sure. However, we can't skip number one. Okay, we got number three, we got number two. So now, tell me a little bit about what is the number one thing that differentiates Lakeside Dental Arts from everybody else.
I would say the biggest thing that makes us different, and I don't want to overuse the word experience. So I'll just say the customized, personalized experience that you have there. So it's customized, it's personalized. What does that mean? How is it different really than anywhere else? Because we really pride ourselves in taking the time with the patient. For instance, when you have a new you're a new patient, you're coming for your complete exam as you did.
Right.
You're in the doctor's chair. You're sitting with us. We have a whole hour cut out for just you, and so a lot of places you won't get that. You'll have, you'll see the doctor for less than 5 minutes. They come in, look at your teeth, call out some numbers, and say this is what they need, and then somebody else talks about the treatment and why that's recommended. But we really, when the experience is a holistic approach here, but I think when I talk about it being customized, now that's when our chance to sit with the patient and say, okay, this is what I recommend. This is the ideal way to restore your mouth. And not everybody has the ability to do that financially or time-wise.
Sure.
A lot of our northern friends are coming and going, and so they're like, they need an implant, but we're not going to be able to just put an implant in and put a crown in all the same day. It's a process. So we sit there and we really plan with them, okay, if we were to do this right now and time things out, and us doctors are doing that with the patient to make sure that they're having the best treatment possible. And so Whether it's finances that they're restricted on, we sit down and come up with a plan. We're not going to say there's only one way to restore your mouth, and that's the cool thing about dentistry is there's, I always said a mentor of mine in school told me you could put 5 dentists in a room and you're going to have 6 different opinions on how to fill a tooth or how to address a tooth. So,
yeah, true.
And that's where we're able to customize it and personalize that experience for the patient.
Well, I think that's important is that it's not a cookie cutter approach, and one of the reasons I was looking for a new dentist is because the dentist that I did go to, it had gotten kind of bought up, if you will, by some corporate dentistry. And now you felt more and more like like a number.
Right.
You felt more and more like you said, the hygienist does their thing, and then they're fine, everything's great there, and then all of a sudden it's like, boom, 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 3 to 4 minutes, not really even paying that much attention to what you're saying, during the time period. They're just kind of looking at what their next major thing is that they have to deal with, or and then you're gone, and it's like, okay, see you in 6 months, and that's it. And so I that wasn't what meant a lot to me. I wanted to make sure that we got, like I said, that personalized approach, and I do definitely value that from the moment you walk in the door, from those receptionists to all the way through, and then even as you're leaving too.
Yeah, and that's what we really work hard on, is that everyone has that same flow of experience, that they're going to spend some time with the assistant before meeting us, and the assistant's going to get to know them a little bit, because the assistants also have a large role in their overall experience over the years. A lot of times these patients connect with the assistants because they're talking to them more.
Sure.
And, when we're out of the room and we're in between things, the assistants in there interacting with them, and so a lot of it, that's why I say that the experience is really what does make us different, and how it's a customized aspect of it. It's the ability to just sit down and we're private, we're not corporate, so I don't have someone who is
There's
not
no quota.
Exactly.
Right.
There's no person looking at a treatment plan I do and say, oh, well, why didn't you recommend this or that? And I have a lot of friends that are in those settings, and it's just extra stressful for them, and then they feel like they're not able to give the best treatment for the patient because they are worried about they're getting in trouble, for not recommending enough treatment or what have you. So
you only saw 10 patients, you're supposed to see 12 or whatever the number is. Yeah.
And so Dr. Willie has always told me over the years is if you treat people right, you'll be well taken care of. You'll have enough patients in your practice. They're going to send patients to you. They're going to refer their friends and family.
Right.
And it's not about I can do the best filling in the world, believe it or not, and you're not going to know in your mouth. You're
Sure.
not going to know, but you're going to know the experience you had, and we're going to know how good that filling was in a few years if it holds up.
Of course.
That doesn't matter to you really, until it goes bad. But what matters to you is how we made you feel and your overall experience. So when you have to come back and get another filling, you may or may not dread it, and so that's what we focus our approach on.
That's it. Those are the big 3, if you will. Number 1, obviously, is that customized, personalized experience. Number 2, of course, all the digital technology that's there, and then number 3, obviously, the availability for those emergency appointments and such. So those are, and there's a lot of, as we've been talking about, there's a lot of sub items underneath each one of those. But those are kind of the big 3 things that really do set Lakeside Dental Arts apart from the rest. Again, located at 2660 US Highway 27 South. They are at lakesidedentalarts.com, 863-658-4272. You mentioned and you touched on a little bit on that mentorship, and so I definitely want to touch on that too in just a moment. That's coming up next on the Medical Hour. Don Elwell with the Medical Hour, talking, of course, with Dr. Dalton Helvey of Lakeside Dental Arts. And Dr. Helvey is getting close to celebrating, not quite yet, but getting close within the next month or two, his 1-year anniversary there. So he's certainly the newest. Dr. Moose has been there for about 3-4 years.
Yeah, I think he's going on 4 now. I think
4 years?
This summer will be 4 years.
Okay, so about 4 years there, and of course Dr. Willie's been there for obviously he's the one that started us. He's the founder, if you will. And you were mentioning before the value of his mentorship when you were younger, and kind of putting that seed down and letting it grow when you were considering dentistry.
Mm-hmm. Yeah, absolutely. It was a lot of people. When I was in dental school, I was on the admissions committee, so I would get to sit in on the interviews and actually be a part of that decision of who gets in and who doesn't, unfortunately. Nice. But it was a great experience because I get to hear all these stories, and a lot of people didn't get that same experience I had, to where they could go into a private practice unless their parents or someone in their family was in dentistry.
Like a legacy thing, yeah.
Right.
Mm-hmm.
Dr. Willie had an open door policy where I could come in whenever, and what was really cool is his assistant Janet, who's still with us. got to where she'd be like, hey, you want to assist Dr. Willie, you can assist him. And so they kind of trained me up on the process of assisting.
Gave Janet a day off, really.
Yeah, well, at first it started with her standing by my side, like, hey, this is what he's going to want next. Because if anyone's worked with Dr. Willie, they know he works fast. And
sure.
Just, because he's been doing it for so long, he could do this stuff in his sleep, really.
Right.
But so Janet kind of trained me up, and here I was as an undergrad college student assisting Dr. Willie, and that gave me the experience because, I mean, now you have a front row seat as to what's going on.
Well, a little confidence, too.
Yeah, so and it's like, okay, like, I do like doing this and being a part of the treatment. So that was one of the biggest things, because then, you know, in those days it was pre-COVID, so the dental school in Gainesville would actually allow undergrads to actually go in and assist dental students, and so I would go in and get to assist them, and then they would kind of realize, they would be like, have you worked in a dental office? And I'd be like, kind of, but no, not really. You know, the guy who's my mentor has trained me on this stuff, and they would come and ask me to assist them. And once I was in dental school, I was hoping that I would have the same students coming around, but then COVID happened, so they don't really allow anyone in the clinics anymore. But but yeah, because of that experience, you know, I always had a front row seat to dentistry, and you know, my mom being a dental assistant was a part of it, but really, Dr. Willie, as I got to see him interact with patients, talk to patients who were in pain, and how he helped them get through that, patients who needed extensive treatment, and you know, it's hard to tell someone that, hey, we need to remove your teeth and you need to go into a complete denture. That's not an easy conversation to have with anyone. You know?
I wouldn't think so.
It's also, on the other side, it's not an easy conversation for someone to come in with pretty much healthy teeth, maybe needs a couple fillings, maybe some crowns here or there, an extraction, but they're like, I just want to take them all out and get dentures. And it's like, well, how do I convince this person they don't need dentures now?
Right.
Because they don't understand that. I always tell people, dentures are not a replacement for your teeth, they're a replacement for no teeth. And so you have teeth.
No, that's a good point.
You trade or teeth problems for denture problems ultimately. So there's both sides of it, and I've got to see Dr. Willie have that conversation many times with patients. So you know, I feel like there's a lot of quotes or little phrases that I say to patients that I remember hearing.
You picked it up from him.
When I was 18 years old.
No, that's good.
But that's what's great, is because that experience has kind of shaped me into the provider I am now, which is really cool.
So and now, and of course, Dr. Willie himself, I mean, his family was in dentistry too, right? It was himself, his dad, his grandfather also. So it's kind of a cool, like I said, it is this long legacy, if you will.
Yeah, and that's where, you know, and I think in any industry, having a mentor is critical. You have someone who has walked the walk, and they know the red flags to look out for and how to get over those bumps. And you know, with having that mentorship from Dr. Willie, both Dr. Musa and myself learned so much from him. I learned a lot from Dr. Musa as well. You know, we're both less than 5 years out of dental school, so there's a lot of things that we come across that we might recognize as a challenge that Dr. Willie doesn't even recognize as a challenge because he's been doing it for so long. So if I go to Dr. Musa and say, hey, like, what would you do here? And it's just great, the team that we have there between us, to be able to collaborate, sit down and look at a treatment plan together, and just kind of really calibrate each other, because the last thing we want is our patients coming in being like, oh, well, he recommended this and now you're recommending that. Like we really pride ourselves on being calibrated when it comes to treatment we recommend.
Yeah, you guys want to be in sync for sure on that type of stuff. Now, is this something then, I guess, as a mentor or role model? I mean, are you looking for, as your career develops, to kind of become that person going forward?
You know, I've always loved being a mentor or a tutor to those behind me. You know, there's a couple pre-dental students right now that I'm still in touch with that are getting ready to apply to dental school. And I always tell them, like, hey, if you just want to come hang out in the office, you're more than welcome. And there's one here in town, he works with Dr. Gelf, and you know, he's looking at that down the road as he's taking his courses. So he comes and helps and volunteers at our Day of Giving. And so it's just, I think dentistry is a really cool community of supporters that, you know, if you ask anyone in my class, hey, someone lives in your neighborhood and they want to be a dentist, can they come shadow you? They would be like, absolutely, send them in. You know, and you don't get that in a lot of industries, especially the medical industry, because, you know, it can be weird for the patient having someone else just stand there and watch. But, you know, that's what's great. A lot of our patients are really open to that, just letting others learn from the experience.
Well, and that's, again, they're relaxed in the environment.
Right.
And so because if it was a real tight, nervous.
Yeah, they might be like, I don't.
And they wouldn't want to do that.
No
exactly.
extra eyes, please.
Yeah, I don't want anybody to hear me scream. No, it's not gonna. But there's no screaming. So that helps out quite a bit. Lakeside Dental Arts again. You can give them a call right now because they're actually open right now. So if you want to try to schedule something, if you're be a new patient, as you mentioned, it takes about an hour or so for that initial consultation, right?
Yeah.
863-658-4272. Again, that phone number, 863-658-4272. There's just legions of people that just do nothing but just swear by Lakeside Dental Arts, and y'all are so involved in the community.
Yeah.
You just do a ton. Most recently, of course, I got a chance to see from the front row. You all taking a major role in sponsoring the luncheon there for the Alan J. Sebring Chamber of Commerce scholarship luncheon.
Yeah.
We got to kind of salute just some amazing students. Did you go to luncheon?
It's impressive. Yes.
You were at the luncheon.
Yeah.
I thought you were there.
Yeah,
and
it's impressive.
It's like I said, just to see what some of these students have accomplished, and they're only 17, 18 years old. It's incredible.
It's really encouraging too, to see like, okay, there's still students out there chasing the next level.
Yeah, because we all generalize about the next generation, right?
Interact with some of those students, and you're like, okay, there's hope.
Yeah, exactly. When you give somebody the bill's like $4.10, you give them a $5 bill, and they have to punch it in to figure out the change.
Right.
That's the ones that concern me a little bit.
Yeah.
But yeah, these folks were absolutely incredible. But you all sponsoring that luncheon is wonderful. Plus, making a donation, of course, to the scholarships, and they were able to break records for what they gave this year. Also, the Day of Giving, and we've talked about that before. That's the single biggest, probably most exhausting day that you have, I would think, right?
But one of the most fun too.
Yeah.
Yeah. Oh yeah. Our whole team gets super excited for that day, and it's exhausting, but it's a lot of fun.
So and that's usually September-ish?
September, yeah. And we did last year. We did it in August. We moved it up to August because we did a September 11th event. It's normally mid-September, and so I think we're going to move it back to September. Middle of August is, I think, kind of tough for a lot of people getting their kids started in school and
good point.
So,
and
people are still maybe on vacations and such. So I think we're moving it back to the September range, but we shouldn't have an exact date here soon.
Well, in September versus August should be like 1 degree cooler.
Right. Yeah. A little less humidity, maybe.
I don't know. Maybe like I said, 1 degree or so. Have you seen the weather report? Did you see Monday?
No.
The temperature's supposed to be here in Monday?
No.
Remember, it's May, right?
Uh-huh.
So Monday, 97.
Oh,
That's the high. 97 degrees.
That rain we had last weekend can come back if it would like.
I was like, are you kidding me? It's gonna be a little warm. Anyway, again, LakesideDentalArts.com. If you want to just go on to Google, you can go on to Google, you can go on to Facebook, you can go on to Yelp, you can go any of these places there. I even looked on Facebook where people go to bash the dental care on social media, and Facebook, you all have a 4.9. I mean, it's just that's incredible all by itself as well. Maybe more impressive than the Google reviews, but 932 Google reviews, a flawless 5.0 ranking. It's just really, really impressive to see. Now, shifting gears just a hair, I've heard through the grapevine, and I even saw it on social media, so I know it must be true, that you may have been in attendance at this Final Four basketball game with your University of Florida Gators. Is that correct?
Yeah.
We got to touch on that a little bit. We got to touch on some successes because you've not been here since that basketball championship happened and that big run. And I want to get your take on all things San Antonio and how that went down as the Medical Hour continues in just a minute. Don Elwell with the Medical Hour, talking with Dr. Dalton Helvey of Lakeside Dental Arts. And we're talking all kinds of dentist stuff. And I always save the last few minutes of the show usually for food talk. But today, though, we're going to change it up just a little bit, Dr. Helvey, because I know you're a big University of Florida Gator fan, and of course alumni and everything like that. And you actually went to the Final Four?
Yeah. My wife and I. It was my wife's birthday the day we flew out there.
It's a gift for both of you, really.
If anyone out there wants to try and go to any sporting event, specifically a basketball game, March Madness game, and it's on or near a special event that has to do, like a wife's birthday, anniversary.
Sure.
I recommend starting. I didn't do this intentionally. This was just the outcome. We did a bracket challenge with my college roommates and some of their wives. Where, we all filled out our brackets and we're following the tournament. And my wife was in first place for a while.
Oh.
And she unfortunately picked Alabama to win. I don't know why.
What?
anyways, that's another.
People have got divorced for that.
Right. So, but anyways, they were eliminated pretty early.
Yeah.
But she was so invested. She was like, if Florida goes to the Final Four, like I want to go, and I would say less. Tickets are bought. We're there.
Yeah, exactly.
I didn't have to convince her.
You didn't have to twist your arm at all.
So we went out there that Friday. The game was on Saturday. It's just phenomenal. I've never been to San Antonio.
Okay.
I've heard a lot of great things about the Riverwalk area.
Oh, yeah.
Very impressive. And the coolest thing really is, if you go to a Gator game, it's all Gator fans in Gainesville at least.
Sure.
You go to a Bucks game, it's all Bucks fans.
Of course.
But you get out there, there's 4 teams still in it.
Right.
Final Four. And there's fans from all 4 of those schools there, and it's just really neat. It's a neat environment. Everyone's there cheering on their teams.
They're all wearing their colors.
Yeah, and you can't even really have that rival feel. You're just like, all right, I hope we're the ones that come out on top, because like all these people, man, they came out for that. So.
Oh yeah.
But it was just a really cool experience. The game itself, there was times in the first half. First 80% of the game where I was like,
exactly.
This isn't even enjoyable. Why did I come? I can't even breathe. I don't want to get up out of my seat to go to the bathroom.
Yeah.
But obviously a great outcome, a great final result.
I noticed that as the games got further into the tournament, so that with Florida and stuff like that, they would be behind a lot more than they were ahead.
Yeah.
I mean, they were ahead when it counted at the end, but they would be behind, and sometimes kind of almost like, it's kind of like that horse that doesn't get whipped until the very little bit, and then all of a sudden just takes off.
Oh yeah. Yeah. And there was a couple games like that this regular season where we had a lot of blowout wins, and there were some of those games where we had to come from behind. And myself and my 2 college roommates, we were still in a group chat. We always stay in touch, and we always talk during those games. And one of the things I would always say, like, we need wins like that, those close wins where you come back and you barely win by 1 or 2.
Yeah.
Because that's what happens in this tournament, and unfortunately, it happened too many times in the tournament.
I know. It was cardiac time.
Yeah.
It really was.
So,
I don't have the tie that you have to the school, but. If you've ever watched the movie Seabiscuit, it's the best example. It's like let them see the other horse in the eyes, let them get ahead a little bit, and then let them make the move. It's like, okay, I just keep waiting for that move.
I know.
It's like later and later.
I don't like that mindset of a game, especially I don't know, because when it comes to like, okay, what are the odds when this guy throws up a shot with a few seconds left in the game that it's actually going to go in? Like, the odds are so low.
Well, I vapor locked on the star's name. What was it?
Walter Clayton Jr.
Yes, Walter Clayton Jr.
Actually from Lake Wales.
Decided to take the first half off in the championship game.
He was on the court, but I think he had like 3 shots and no points.
No points at all. I was like, this is kind of the big one, right?
Yeah.
And I know he did, but it was they had really keyed in on him. Yeah. They had shut him down. They said, okay, if we're going to get beat, it's not going to be by him.
It shows, it goes to show that preparation really counts in these games. People will say, it's just going to matter how those players get out there and play. No, they shut him down.
They did.
And that's what kept them in the game.
They did,
they had
absolutely.
the best defense, but he's not going to be shut down for an entire game, fortunately.
No, and thankfully when he came through, it was at the perfect time. Again, that horse racing to the finish line there.
Yeah.
But, it was amazing.
Yeah,
it really was.
The atmosphere in that place, just obviously for Gator fans and not so much Auburn fans, it was just incredible. It was just really cool to be there and experience that. And we went out to Omaha a few years back when the baseball team was in the final series, and unfortunately we fell to LSU on that one. But still, they're just cool experiences to go and see. Being so tied into the sports world, it's just like you get goosebumps. And my wife was looking at me, she was like, "There's tears in your eyes?" I'm like, "No, stop. Just leave me alone."
Watch the game. Watch the game, woman.
She was like, "Did you cry when our son was born?" But it was just really.
I'm just so happy you get to experience this for your birthday.
Yeah,
that's exactly it. Oh my gosh, that's funny. But yeah, I can only imagine. And again, college sports just has such a different feel than professional sports. Mm-hmm. And most of the time, until you get to like playoff time, college sports I think is better. Mm-hmm. And when you get to like baseball playoffs or World Series type stuff or NHL playoffs, those are really, really good too. But up until then, man, there's nothing like the March Madness tournament.
There's so much heart around those games.
It's incredible. It was incredible. And of course, quick commercial on this one too is all those games were available. They were being streamed live here at ESPN, by the way. So it was kind of fun. So it was really cool for all the Gator fans to be able to participate and see that. So I don't even want to ask how much those tickets were.
Surprising for the games themselves, not too bad.
Really?
And I want to say under $300, I think, per ticket.
Per ticket?
I mean, we were sitting with the rats in the last row, I think. But, and I've been to the Orlando arena, so I thought, last row was still pretty close.
Yeah.
If you've been to a Magic game, but that San Antonio Spurs place is large enough for like 3 football fields, and so luckily we were kind of towards the middle of the course, so we still had a decent view. But binoculars would have helped probably too.
Oh, absolutely. You probably could have seen it better on the TV.
Who's on the court right now? I don't know, but we scored.
yeah. We're winning on the Blue Ants. Yeah. The Blue Ants, exactly. So anyway, again, of course, Dr. Dalton Helvey, and it sounds like a wonderful experience. I'm glad you were able to participate in that. Lakeside Dental Arts, folks, again, from top to bottom, just a wonderful experience. And we talked about championships, and we talked about, businesses locally that have 932 reviews, maybe up to 933 or 34 by now, who knows. Again, they're getting close to that 1,000 mark. They've got some major announcements coming in the next few months, obviously in addition to, of course, their Day of Giving that's going on, so there's always something exciting going on over there. If you want to give them a call, 863-658-4272. Dr. Helvey, thank you so much for being here.
Thanks for having me.
We appreciate it. I know you got work to do.
Oh, yeah.
Work on the practice a little bit.
All right.
We'll talk to you soon.
Take care.
Thanks again. Thanks for tuning in to the Medical Hour, everybody. You have a great day, and enjoy Alan Archer and, of course, the news and the rest of the day's programming. D&D Live tomorrow.